eczema is a very common, but is that the same thing as you were mentioning before for that sort of like atopical skin condition?
Yes,
Okay.
yes. It's an inflammatory process in the skin. It's usually caused by either an allergic reaction, something called contact dermatitis, which is like irritation by something that's actually rubbing against your skin,
Okay.
or dry skin.
So what are the symptoms of eczema?
Eczema, what happens is you usually break out in a very minor rash, a little bumpy rash that's very itchy. Eczema is very, very itchy.
Oh, so itchy. And I noticed that so many kids that have it, I also noticed adults that have it as well. So does that mean that maybe the condition wasn't treated as a child, or can it flare up at any time?
It can flare up at any time. The idea with eczema is that you really need to control your symptoms early on in life. You need to have a very good skincare regimen so that you don't have flare-ups.
So how does it run in the family?
It does. Eczema
Okay.
runs in the family, and it actually runs as a triad with allergies and asthma. So usually if you have a family that has asthma and allergies, eczema is right there with it. And you might have all three, or you might have one of the three.
Okay. Now here's a question for you. It's very common that it happens always on your hands, mostly your arms or your limbs.
Right. The common places for eczema patches to flare up are in the elbow area,
Okay.
behind the knees, the wrist, and yes, sometimes the fingers.
Wow, okay. Now, this is a question I have. What's the difference between eczema and psoriasis? I mean, because psoriasis is also a skin condition.
Psoriasis is a skin condition. It's a lot more severe. It's a lot more chronic, and it
okay.
doesn't happen in episodes. It's pretty much constant. And that you would need to be treated by a dermatologist
And that's
followed.
that's a managed chronic.
Yes.
Okay, okay. Now let's talk about some of the treatments for eczema. So can you walk us through these?
Absolutely. So number one, moisturizers. You need a barrier ointment in order to protect your skin from any type of invasion. You need antihistamines, are going to decrease the histamine response in your body so that you can help manage the itching. Steroid creams help decrease the inflammation, so that actual redness, the rash that you see with eczema will be controlled by the steroids. And then systemic corticosteroids, basically steroids that you would actually drink or take as a pill. That is for the more severe case that is just not responding to topical medication.